Mr. Goldstein, rebuttal.
No one has ever died from taking medical marijuana, ever. The toxicity rate of marijuana is 0. The LD50 rating is 0. You can't die from medical cannabis. It's not possible. That's the biggest falsehood in reefer madness I encounter, and I'm surprised to even hear it here tonight. But what impact would it have on state police? It's called the Compassionate Use Medical Marijuana Act. And I believe policemen and those in law enforcement actually have a deep vein of compassion within each individual. I would not want to put a bulletproof vest on and stand between you and the most violent members of society, but police do. How do they feel when they arrest someone with cancer or MS and send them to jail because they're following the letter of the law? This Compassionate Use Medical Marijuana Act is compassion for law enforcement. No longer will they have to wake up in a sweat at night thinking about the AIDS patient that they put back into prison. No longer will cops have to wonder about the impact they're having. They can just read the registry card and let the medical patients go.
Thank you. All right, Mr. Goldstein, question to you. Should private insurers, Medicare and Medicaid, be required to cover medical marijuana treatment in New Jersey?
In New Jersey, no. I don't think that that's a good stance to take at the get-go. As medical marijuana evolves in America, it is my hope that one day it will be an approved, insured method of treatment. But right now, we don't ask insurance companies to cover your Tylenol if you need to go get ibuprofen or if you need to go to the store to get a cold medication. You don't apply for your insurance company to cover over-the-counter medication. That's what I consider medical marijuana to be. It's a non-toxic substance. You can never purchase an amount of medical marijuana that can kill you. So that's opposed to ibuprofen. All of us could walk into a 7-Eleven or a Wawa right now and purchase enough ibuprofen or codeine to kill us. But even in an alternative treatment center, you could never walk away with enough marijuana to kill you because it's impossible to do so. So I consider it more of an over-the-counter medication and would not advocate strongly for insurance companies to be involved. Without federal prohibition and with a well-regulated medical marijuana program within the state, the cost of cannabis is much below the underground market value. So it becomes a very cost-effective medication once you take prohibitions away. People often think that marijuana is very expensive, especially for good marijuana, but what you're dealing with is the cost of prohibition, not really the cost of pot. In a regulated medical marijuana market like California, and I have seen this in person, and also in places like Oregon and Colorado, oftentimes the marijuana is free. I've seen many patients who receive their marijuana for free from co-ops, from collectives, from dispensaries. So in some cases now, it's not as much of an argument. The cost is low enough that insurance companies wouldn't have to get involved. I'm not sure, for the same reason that pharmacists could not handle medical marijuana, because it is still a federal Schedule I substance in the Controlled Substances Act, that any insurance company could until we saw some movement in those federal guidelines. So one day, I hope so. But more than, with increased research, because that's the other thing about medical marijuana in New Jersey. We have universities and colleges and medical centers. In California, medical marijuana is well studied. They're coming up with new methods of treatment every single day. And if we could find those new treatments out there, especially when it comes to anti-cancer and anti-tumor, maybe one day insurance companies will be helping you with a THC derivative that will help cure your cancer. But today, we don't need an insurance company involved with the medical marijuana dispensaries, because under a well-regulated, well-run program, it is less dangerous than buying Tylenol over the counter, and it is certainly going to be less costly than the underground market.
Thank you. Rebuttal, Mr. Farley.
Well, as usual, Mr. Goldstein will make up any kind of argument he wants. First thing he says, they're getting it for free in California. Well, they're supposed to be clinics in California where you get it for free, but they're getting $6,000 to $8,000 a pound. All of the major prosecutions in the state of California are because the people who have the medical dispensaries, as they're called out there, make an average of $4 to $6 million a year, and every month or two you see some major federal case with someone going to prison, which is why Eric Holder, in his comments today, didn't say the states couldn't go after these people. he didn't want the federal government to be spending as much time and effort. They're not going to have to, because the state law enforcement officers are facing such a crisis that they're reacting to it now and making the arrests.
Thank you. Mr. Farley, what policies should be in place if one of the bills passes in November to keep marijuana from being abused by the general public?
Well, unfortunately, the one policy that should really be in effect, I don't think we have any ability to pass. And that is, since both bills give the opportunity to change upon the recommendation of our state medical association, not the doctors, but the state the state health department can change any part of this act that they want. And we expect that that's one of the things that will happen, as has happened in other states, that there are more drugs that can be used in greater amounts without, again, having any testing process whatsoever. Mr. Goldstein made a comment about nobody dies. They always say that because it's not toxic in that nature. But tell the mother of the 14-year-old girl who lived outside of San Francisco whose brother gave her an ecstasy tablet, and instead of getting her medical treatment, they gave her medical marijuana, and she died the next morning. Tell the people who've been murdered by marijuana users. One of the biggest problems with marijuana is the effect it has on young brains. And we have case after case throughout the country, all of which get major publicity, showing that these kids, because they have used so much marijuana, have murdered people for crazy reasons. There was the lawyer in California whose wife was murdered because the pot user thought his pot was delivered to their house and not his. And there are cases like that all over. There's no way that you could start a bill like we have here and say it's never going to be misused. There is a way to do it. Let them do what I've asked time and time again. Say here tonight in front of all their advocates, we'll propose a bill and agree to it where we use an inhaler like Sativex, we use vaporization or we eat it, but we don't want to smoke drugs. Not going to do it. If he does it, I'm the first backer.
Thank you. Mr. Goldstein, rebuttal.
This is 2009, 1937. I just have to make sure of that because that's the year that Reefer Madness came out. There is no aggressive nature in marijuana smokers. Those cases cited by Mr. Farley are completely false. I really have to wonder at that attitude, though, towards marijuana users out there. Medical marijuana is something that is beneficial to the public. It is beneficial to the users. And bringing up other drugs really doesn't play into the equation. But again, you know, that is the nature of narcotics officers and people who work in narcotics. They mix these things together. Medical marijuana is a singular argument, there to help the sick and dying patients of New Jersey. It does not have any aggressive impact on the user, quite the opposite. And quite frankly, rhetoric like that, lying to the public, especially from a position of somebody who's an instructor here at the college and in a position of law enforcement, is the thing that undermines the credibility of prevention in the future. And I really do hope that opposition will stop lying at least.
Thank you. All right. We're at about a point. I think we're going to take about a 5-minute break, let people use the restroom, take a moment. We'll collect the questions from the audience, go through them, and come back then and start up again.